Okay. Good morning.
Morning.
This meeting is a meeting of the school board and public for the purpose of conducting the school corporation's business and is not to be considered a public community meeting. There will be time for public participation as indicated by the agenda. Visitors requesting permission to address the board on a specific agenda item should sign in before the meeting starts on the form on the board table. The board requested discussion time limit of 3 minutes on any specific agenda item, and we ask visitors to make only one appearance per item. We ask those addressing the board to speak from the podium and to state their name and address. Board Policy 0167.3 dictates that personnel issues will not be addressed. Concerns about individual employees of the district should be brought to the superintendent or designee. The meeting site is fully accessible. Any person requiring further accommodation should contact the superintendent at the school corporation central office. The Board of Trustees respectfully requests those guests and visitors in attendance to be courteous and silence their cell phone. As always, we always start with prayer, so please join me in prayer. Dear Lord, thank you for allowing us to make it through another day. Please be with us as we work with phases on reopening our school. We know this is going to be a difficult decision, but a decision that will take lots of thoughts and lots of other opinions and the direction on this. Please be with all of those kids and all of our employees as we will be opening up here in just a little over a month. Please be with them as they enjoy their summer break and be ready to come back. Please be with all those that serve and protect us for our freedoms. In your name we pray. Amen. Okay, call to order. Pledge of Allegiance. Robert, can you do that for us, please?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
As roll call, everyone is present. Mission statement, Lisa.
Lebanon Community School Corporation will cultivate and reach every student by influencing and enriching their lives through the power of education and do so in a positive and safe learning environment.
Thank you. Item 2, agenda for routine staff matters. Dr. Millman.
Thank you, Mr. Bertrand. I have two staff to bring to you this morning. Almost said this evening.
Yeah.
This morning, a certified physician, Kristen Nestor, recommending for a special education position at Central Elementary. We did have a resignation at Central and a classroom teacher, Mr. Miller. And we are, because of student numbers, we're actually reducing a section number, and this is a replacement for his position. But it'll be a special education position. And I'm recommending Emily Benatsky as a JV volleyball coach this morning.
Okay. All right, board, I need a motion to accept the routine staff matters for the certified and EC8 positions. Lisa? Second?
I'll second.
Liz? Any questions about those?
So this is replacing is this a new position? I know it's replacing one, but this new position at Central?
It will take them from one full-time special education to two full-time special education teachers, but their total FTE for the building will remain the same as it's replacing the classroom teacher resignation.
And do these hires, does that fill all of our open spots?
Yes, we have, this is our last certified position. Well, I take that back. We had one of the teachers, I believe it was the Traders Point special education teacher, that the board approved at a previous meeting, has decided to go elsewhere. So we do have one Traders Point special education position open, but in our 6 schools here, this is full boat right now.
So it's
certified.
For Traders Point.
Yes, yep. We have, that's an opening again.
We have a pending one from Harney coming also.
Yeah, we may have a resignation from Harding Elementary in the next days or hours.
Okay.
So, keeping an eye on that one.
Right. Okay. Any other questions? Okay, all those in favor of accepting the certified and ECA position signify by saying aye.
Aye.
Those opposed? Motion passes. Number 3, request approval of resolution for suspension of school board policies conflicting with waivers or extensions during COVID-19 pandemic. Dr. Millman.
Thank you, Mr. Bertrand. This resolution was drafted by Indiana School Boards Association Council. If you've been following Dr. McCormick's guidance to school superintendents over the last few months with their legal counsel, they've advised school boards to adopt a resolution just blanketly, really, suspending policies, provisions within policies that would align with any governor's directives, any state directives, or changes that may be in place due to COVID-19. So this is kind of a blanket statement that we will follow all of those directives. It also directs me to keep you informed on any policies that might be affected by any of the governor's directives and whatnot. It just kind of helps us align it if there's ever any questions or challenges about why are you not following policy versus the law. So it just gives us some assurances, and our community some assurances that we're going to be following all those directives.
So it's basically the state's given us an outline.
Mhm.
Every school, state of Indiana has to follow this outline.
Right.
And
Right,
Yeah.
right. And there may be some things within our policies that don't align directly with some of those
Right.
directives. So what you're saying is we will suspend those so you don't have to do them one at a time
Right.
as the time arises.
Okay, board, I need a motion to approve this resolution for suspension of school board policies conflicting with waivers or extensions during this COVID-19 pandemic. Second? Any other questions about this?
I imagine these will be reviewed probably on a daily basis, or if not hourly.
Yeah, it's hard to say what directives may come down the pike that haven't already done so. That's a little bit hard to predict, but this just does give the board a little bit of political and legal cover, if you will, that there's no question about which policy or we'll follow the law, basically, is what this saying this is saying.
Good idea.
Yeah.
It'll be interesting when the COVID-19 pandemic is actually done.
That is a question. As I've read through this resolution, it says for the duration of the,
Right.
but it does mention it's for the duration that the waiver is in place. So, those directives from the governor so far have some sunset clauses on them. He'll have to re-up some of them. Some may take legislative action. So when the legislature comes back into session, this may come into more of a play because it will be based more on what the legislature decides to do.
Okay. All right, any other questions? None. All those in favor of the approval for resolution of suspension of school board policy conflicting with waivers or extensions during COVID-19 pandemic, signify by saying aye.
Aye.
Those opposed? All right, motion passes. Item number 4, request approval of LCSC 2021 reopening plan. Dr. Milne.
All right, thank you. I don't know why I'm not getting the slideshow here. Hang on one moment. I'm missing my slideshow icon here. Here we go. Yeah, I need Mr. Herr. There we go. Now I'm full screen. Thank you. Thank you, Mr. Herr. I appreciate it.
Just sit down. Just sit down.
Well, thank you, Mr. Bertrand. We have a lot of information to cover. There's a lot of bullet points to cover, so I encourage the board to ask questions as we go along because it may be difficult to keep track of all those questions. as we move forward. So I'll just dive in. The areas we'll cover this morning. I did this in some of my superintendent's announcements at the previous board meeting, but I do want to go over some of our survey data from our stakeholders on the response and their opinions on returning to school, an overview of the process, what we're calling LCSC phases of learning, which is our reentry strategy, if you will. And I'll give you more details on that. It's called phases of learning because that's what we are focusing on, is how we will deliver instruction, of course, at various stages. What we're proposing to be our opening phase within those phases of learning for 2021, how we'll deliver instruction to students in person, for those students unable to attend in person. We'll have a conversation here about face coverings and uses of masks, hydration, breakfast and lunch, transportation plan, items such as recess, passing periods, how we'll handle school visitors, school volunteers, what happens if we have a positive case in one of our schools or facilities, and then of course our timeline and rollout for communication. So that's a lot, and honestly that's a partial list of items that we are continuing to work on, but I think that probably the highlights of what most of our families are concerned about. So we'll jump into the survey summary. This is not all of the summary and all of the questions, just some of the highlights that really pertain to opening school. We were pleased that we had over 1,600 respondents to the survey, overwhelmingly parents, and that fell along grade level lines. We had more elementary than secondary responses, but you can see the breakdown there: 1,266 parents and 285 staff members. So we were pleased with that response. I always caution folks with voluntary surveys and remind people that they're not a scientific survey, because they're not a random sampling, it's like you would for elections. It's a random sample of registered voters, for example. But when you get 1,675 of your community and 1,266 parents, that's a pretty high percentage and a good representative sample of folks' opinions. So we were pleased with that response rate. Just a little bit about our communication and how folks think it's going. So most folks, at least in the majority, felt like our schools have done a good job of communicating with families and staff about the challenges and the procedures that we took. Same from the district, they're similar numbers with our communication to parents and the community. So we were pleased. Obviously some room for improvement from the parent, guardian, and student side, but we will continue to work on that and provide as much information through social media and all other aspects. I thought the board may be interested in the top areas of concern among the three groups that were surveyed. The top three areas of concern were the same for all three groups. They were a slightly different order, but you can see that two of those three had to do with concerns about learning gaps that students may have when we went to the online remote learning beginning in March, and just learning and achievement in general. So not surprising, but that's certainly something we've already begun to work on. Ms. Scott and her team have met multiple times already with the elementary principals and elementary teachers. They begin to look at those essential standards when students return to school, what we're going to have to circle back and review, and then of course whether we need to narrow the focus in some areas on language arts and mathematics, for example, to get students back on track. So they've been digging into the standards, digging into their pacing guides to do that, to be ready for the students when they return. This is a very important slide as we prepare for what we're talking about this morning. This is parents and staff. I don't want to leave students out, but as you notice, there was about 100 students out of the 3,000. So it was a small sample. We didn't have a captive audience to have them take the survey, and a lot of the devices were turned in at that time. So it was primarily parents and staff, responded to this. Reported quite or extremely concerned about the health and safety return to school. You can see that approximately 30% were quite or extremely concerned about that. This signaled to us that everybody's ready to get back to learning in the school setting, and so this was an important data point for us as we were considering this with our community. Reported quite or extremely important to participate in traditional back-to-school events. As you can see, not quite as high of a percentage as far as like your ice cream socials and back-to-school nights and things of that nature. But we did have several comments from the community and parents and faculty about the importance of orientation type activities for students, especially in transition years, or students new to the district, or our kindergarten students. So I've asked the principals to work on ways that we can bring families into our buildings physically prior to the start of the school year, and that is less of a challenge in a lot of respects than bringing all of our students back, because obviously we can schedule that by alphabet, by grade level, and we can break those up into smaller groups and allow families to come into the buildings prior to the opening. So that's important for our freshmen, it's important for our sixth graders, and certainly important for our kindergarten families. So we'll be working on that with our principals in the coming weeks. Our phases of learning really is trying to follow the format that the state is following with the Back on Track stages. And I think, and I'll emphasize this again as I show the slide of the phases, that there are no bright white lines or red lines within these phases. You could be, just like the governor's Back on Track stages, you could be in phase 4, which we're in now, or stage 4 that we're in now, and he may elect with his team to dial up some restrictions or dial back some restrictions based on the data within communities and within the state. And I think that's important for us to keep in mind as we talk through this today. This is my recommendation, our recommendation today, on June 25th. We are, what I'm asking for today is approval of this process and plan to move forward. We're not going to stop talking to Doc Surveys, and thank you for being here this morning, Doc. We're not going to stop our conversation with the health department after this morning. This is an ongoing dialogue, and he'll call me up and say, Dr. Milliman, we need to step back and take a look at that bullet point that you're planning on, and we may need to tweak that a little bit based on what we're seeing in Boone County or within your community. So it's important for us to keep that in mind. Again, we want to be consistent with our survey data. Again, our consultation with the health department. We've been in coordination with the Boone County school districts. Last week, we met with the health department with all 3 school superintendents and our teams, and got feedback on this, and we have a joint press release that I think I just got the final draft this morning prior to the meeting, that's outlining our plans in returning. So they've been great to work with. We're trying to be consistent with the area, Indianapolis area schools. And the last bullet is, these recommendations are really just based on, our honest information to you and to the community about what's practical, and feasible within a school setting. So we want to be honest about that, and that's what has driven some of these recommendations today, as well as what can you actually get accomplished when you have 3,400 students and 500 employees in your buildings.
I had a quick question.
Sure.
Along those lines. Thank you, Dr. Surveys, for being here this morning. Do you have kind of a formal schedule of meetings? Is this just ongoing conversation? How will that happen in the weeks ahead and months ahead, or however long we're doing
They've
this?
been kind of an as-needed format to this point. We have not set any formal, monthly meetings, but that may be something that will be necessary once schools are in session and
Yeah.
we're evaluating that, or at least getting some consistent data points that we say, hey, these are the types of data points we're following, and could trigger some different actions. So we'll definitely be talking about that as it moves forward. Does that sound like a plan?
Yep.
All right. So here we go. These are the phases that we propose, and you see that these are 6 phases. The state has 5 stages. IHSAA has 3 stages for sports. Kind of hard to keep them all straight. Phases, stages, and how it all works. Really, in all practical purposes, it's a 4-phase plan because we are leaving phase 1, which was complete school closures, nobody on campuses, nobody in buildings. I'm not aware of any district in Indiana that is going to be opening under phase 1, which is a full school closure and no in-person instruction. Phase 6 is pre-COVID. That's pre-March 12th, before we began shutting everything down. So really, phase 1 and phase 6 are not going to happen as we open. So we're focusing on those 4, depending on where we are as a community. So we are proposing to start in phase 5, and you can see that if we started in phase 2, we would have possibly some selected grades that might be blended, where, in other words, some sort of alternating day schedule where they might be in on some days and remote learning for others, and some grade levels that might be all remote learning. That would allow us to be able to spread our students out throughout the 6 buildings, perhaps, and maybe your secondary students, for example, might be all remote, whereas maybe we'd bring in elementary. So that's what a phase 2 would look like. A phase 3 would be all grades doing some type of alternating schedule to give us an opportunity to clean parts of the building differently and have less people in the building physically. Phase 4 would be selected grades in person and blended, and other selected grades in person and remote. So that would be somewhere we would bring in some students on an alternating day schedule and some students all day. So it just progressively gets less restrictive to where we are here at phase 5, which we believe aligns with both the state, where we are as a state, and what we know and in our conversations with the health department. So this is to open to in-person instruction 5 days per week, but you notice the asterisk there, remote option for students unable to attend in person for all of the phases 2 through 5. So that will be the case here under phase 5. So we'll talk a little bit about the in-person instruction, again, 5 days per week. We will be utilizing Canvas, our online learning management system, because, as you recall, if we have to move back in any of these phases, we need to be able to make that change and to remote learning very quickly. So delivering instruction and assignments through Canvas, even in person, is going to be important for us to emphasize. We'll have our desks in the old kind of traditional setting, if you will, with them facing the same direction. We may need to modify our curriculum. I touched on that briefly earlier, focusing on language arts and math, certainly in the elementary grades, looking at the balance of social studies, science, language arts, and math based on where the learning gaps may be, and helping our students catch up. We may have to modify PE, art, and music. There's considerations there with shared materials. So there may be some things that we have to require students only use their own materials for in those classrooms. We may need some of those spaces during lunch as we're spreading out student seating during lunchtime. So that could affect the way they deliver their curriculum as well during this time. So we may have to make some modifications in those areas.
Let me ask a question
Sure.
about, I was reading somewhere that some school was going to give out water bottles because of like PE or kids during the day going to the drinking fountain.
Mhm.
Has that been? any
Yeah,
discussion?
I've got some slides coming up about hydration and how we're going to handle that. And we're, just as a preempt of that, we are going to encourage and ask parents to help us and send water bottles, full with their students. And we're working on water filling stations throughout the building as well to help with that, so that they aren't able to use the community water fountain, so they're only going to be able to use for filling stations. And Mr. Tate could touch on that a little bit. We've been touring the buildings and determining where those are going to be, so
Okay.
I can touch on that in just a minute. It's a good question. So that, I think that was it, that slide. This is the remote learning option. We are going to be, I'm going to jump to the bottom of this slide. If families are considering this for their students, there will be a selection now when registration opens on July 7th for parents to indicate that to us. That will begin to give us a good trend line of knowing how many families may be considering this. Certainly if you have a child with a medical condition, and it is not in the student's interest to be in this setting, and that's what the physician has advised the family, they may fall into that category. There may be some families who just frankly are not ready for this setting, and we're going to ask them to make that selection, or at least let us know that they're considering that at registration. And we're going to require them to have a conference with the school administration, a principal or their designee, could be a counselor, could be assistant principal. So we really want folks to know what the remote experience is going to be. As you go back to some of the slides from our survey and some of the data that I didn't show today, it will be online. All of our survey responses will be online to all the questions. You will see in those responses some concerns about not knowing where things were, where to find things. There was maybe an expectation that things were going to be live, that were not live instruction. Well, now is an opportunity to say, this is what the remote learning experience is going to be. You know, I want you to know up front exactly what you're choosing so that we eliminate some of that confusion. So there will be a requirement there. The high school students, because they're credit-bearing classes, there may be an opportunity for the student, if the family and student is ready, for them to re-enter in person prior to the 9 weeks. Those would be discussions that would happen with the high school, but we want to have a good, clean grading period break to be able to build a schedule for that student. So we would build their schedule when they would return to begin the next 9 weeks. They could continue earning credits in the remote learning classes through that 9 weeks, and that just gives us kind of a good, clean grading period break to be able to make that happen. So those are important for the families to know. These will not be a live kind of look-in camera into the classroom. You'll hear a lot of discussion around that. You remember the slide earlier about we want to be honest with folks. A lot of that could work. We have technology that on paper could work, but the logistics of making that happen on a daily basis leads, at least me, down the road of concern that if you're asking teachers to balance 2 classrooms, an online classroom and an in-person classroom simultaneously, my concern is that you end up with a mediocre product for both sets of students. So what we have done is we worked very hard with our curriculum assessment, our principals, to select a curriculum that covers all subjects. You've heard us talk about the Plato platform here. It's actually not called Plato anymore. It's called Courseware, I believe, but everybody knows it as Plato. It's designed to be a subject-by-subject, credit-bearing coursework, a virtual course for students. We, of course, will give support to students on that. That's another reason we want to know how many families may be considering this option, because we have to staff it. We want to make sure students are staying engaged in their coursework. We want to make sure that they're staying caught up in their coursework, that they're getting their questions answered, they're getting supported. So, but on June 25th, we don't know whether we need instructional assistants, teachers, how many of each, to assign to that group. That's going to be the secondary platform, is a subject-by-subject Plato platform that we'll review with the parents and the students if they make that selection. We just approved a curriculum for the elementary that will also cover language arts, mathematics, social studies, and science. That is a bit more diagnostic. What I mean by that is that platform will assess the student when they enter those courses and adjust the coursework based on their level, and then continue to challenge them as they move forward. But it will not be a live look-in into their classroom. On the elementary side, we are going to roster the students to the classroom teacher, because this, we hope, right, is temporary. We hope this is very temporary. And so we don't want families, and students to lose their connection to the school. We want them to feel like they're part of Harney, Central, and Perryworth, and Stokes. We want them to be part of the school community. So we want them on the students or the teachers roster for that reason. We also do not want to lose track of the student-teacher ratio when those students return to class. It is our hope and my belief, because our teachers care deeply about their students, that they will be reaching out to them as, class communications, class newsletters, things of that nature. But the classroom teacher will not have the responsibility of daily instruction, daily assignments with the remote learning students. So that's a mouthful there, but it's important to just walk through what that will look like for you should you get questions.
I did, somebody asked me about the remote, and I talked to them about just in the short time we started doing Zoom, we had problems with, Ms. Hutchinson we couldn't hear her at times,
Right.
or she couldn't hear us.
Right.
And it's like, can you imagine a classroom, and it's going live, and the teacher's trying to
Right.
teach, and then
Right.
the kid can't
Yeah.
answer, can't
Yeah.
ask.
Right.
And I said, that's just,
Yeah,
that would be
in theory,
like you said, be a mediocre. You're doing a mediocre product,
Yeah.
so.
In theory, it could work. And I feel kind of the same way of just saying, hey, your assignments are on Canvas, get them done at home
Right.
on your own time. We didn't feel like we were giving, in the elementary sense, that's really what I had in mind when I was making that statement, a solid platform to be able to practice the skills and knowledge necessary to progress. Is it going to be the same as sitting in front of a teacher? No, it's not. But these are family choices, and we want to be upfront with what those choices are going to be, and we're not going to offer a product that we haven't. The elementary principals, Mrs. Scott and others, did a great job. There was a spreadsheet of a dozen products that they took a deep dive into and landed on one that we felt like, for this purpose, will serve our purpose for that short term. The good news is, for now, when we're making the purchase of this product, we have site licenses for all of our students and all of our teachers and all of our elementary schools for the entire year. So, and it's a good product. So for at least this school year, even the students that are in person, teachers are going to be able to assign some remediation and intervention through this product. So it'll help us on both fronts. This has been a big topic for reentry of schools, not just in the state of Indiana, but all over the country. We're strongly encouraging the use of face coverings from our staff and our students. They'll be required in our clinics, and according to our athletic and extracurricular plan, students that are going to be in our clinic or getting treatment from our athletic trainers are going to be required to be masked according to that plan. We do have an inventory in our school, but it's a limited inventory. Our teachers and staff will make a request to the principal if they have something that they need to help them be more comfortable in the classroom, whether that be a face shield, whether that be a mask. It could be a number of requests that they have. They'll make those requests to us. The parents should make this choice, and we encourage and we want all of our students to have a mask with them at all times. We're going to be asking our families to help us with that, because there may be times that it is necessary for the student to be in an area where they're required. We're going to be emphasizing how important it is to wear face coverings in hallways during transition time, and I'm going to be asking our staff to model that for our students. That anytime you're in a transition and you have a less predictable ability to have spacing among you or facing the same direction in the classroom, that you have a mask on. So those will be emphasized, and we are asking families to help us with that. And now this is an area that, again, I'll point out that is on June 25th. I said there was no bright white line in these phases. We could still remain in phase 5 and begin to say there are some areas that they maybe need to become required. I don't want to throw out a bunch of scenarios about where that would be, because I don't know where that would be, but those are the types of conversations that we have with the health department. What, again, comes down to practical and feasible to be able to maintain in your building. Can you, Mr. Hers asked the question here in the board meetings before, what are you going to do if they don't have it on, right? So how do you handle that, and how many students is that? So it's not something you can create a detention room for, not in a pandemic. You're going to be removing masks for breakfast, removing masks for lunch, removing masks when you hydrate, when you're taking drinks of water throughout the day in various settings. Dr. Box, when she presented with Dr. McCormick to school superintendents just last week in the webinar, was discussing, well, it's probably not feasible to expect kindergarten students to go an entire day with masks, but everybody should wear masks, right? So it's these conversations, and Doc's, Serbies is probably smiling from behind his mask out there right now, because these are the conversations that we have had about the feasibility of being able to maintain a strict, you have to wear a mask all day, because that's not what will happen. And if you're saying, hey, desks are facing the same direction and we can deliver instruction and students can respond to the teacher without the mask, students are in the classroom far more hours than they are in the hallways. And so if we're saying we're delivering instruction and there's times where the mask can be removed during instruction, you find yourself twisting yourself into a conversational pretzel, if that's a phrase, about how to deal with this topic.
Well, and I
So-
think also the wearing of the mask. Some kids will, some put it underneath their nose.
Right.
Some will put it over their nose.
The
Some will-
consistency
I mean,
of it,
it's-
right. Continuing to emphasize to our principals that when we say we're encouraging their use, we want to be honest about that, and we want to encourage their use. It's important, and that's the data that we're receiving. It's important to do it. There's some great videos out there for young kids talking about the proper way to use them. I've talked to at least 2 elementary principals that are working on some homemade videos with their staff and students that can be fun to help remind them of that. So we will strongly encourage it. I mean, we're not going to say it and then not strongly encourage it, because we know the importance of it. We just want to be honest about the practical application of saying required, because when you say required and then you list 5 exceptions to the requirement, it gets difficult to have that conversation. So that's where we are today. It's a choice too that the parents have. I've had very good and productive and positive conversations with parents, both over phone and email, with concerns about this. And I've emphasized to them, hey, if it's required for your family, please continue that, and we'll try to support you in that. So have your family meeting and say, for this family, and email the teacher or call the teacher at the end of the day and say, did Michael wearing his mask today? And they'll be honest with you and say, yeah, yes or no. He was taking it off all day long, and we'll work with you on families' wishes and how they want to deal with that. So that's how we're handling this. Yes.
I just appreciate all the time you put into
Yeah.
it, and the more we can communicate all those points,
Yeah.
the better.
Yeah.
Because I think it looks like a simple requirement,
Mhm.
just
Mhm.
wear your mask, it's required, but
Right.
like you said, there are so many exceptions, and the
Right.
more we can get that kind of dialogue out there, I
Right.
think people will understand more and maybe
Yes.
kind of calm
Yes.
some of the
I hope so.
debate.
I hope so, yeah. Appreciate that. And I think too, when maybe they see some of the precautions we're taking as a district, that has helped too in our conversations, which is the next section. We are in the process of installing plexiglass in all of our offices and points of sale. So all the point of sale areas in our cafeterias will have plexiglass between the cafeteria worker and the students. I'll just pause there too. I think maybe it's coming up later, but there won't be any students using shared keypads and cash transactions and things like that. So that'll help in the cafeteria. We have purchased the ultraviolet light source. We'll have at least 2 units in every school. Classrooms on all spaces, clinics will be daily use of the light source, and then classrooms will be on a rotation. It takes between 45 to 60 minutes to do a space about the size of a classroom, so they will be on a rotation. But should we have a hot spot or a positive case that we need to concentrate all of those UV light source devices into one building, we can do that, and we can go into one area of a building or we could do an entire elementary in one evening with the light source machines. And we're buying local. We found out that they're manufactured right here in Lebanon, so that was kind of a plus. We are adding air filtration in our buildings. Some places is easier than others in sliding in filters. Some our buildings are different ages, but where feasible, that might be more of an overlooked but important item. That's very important for us to maintain air quality. Adding custodial staff. We will be assigning custodians in every school throughout the day. Their only job is to wipe down high-touch areas, doorknobs, any type of high-touch areas within the building. That will be their job throughout the day. Our staff will be going through a training. As you're aware, we have an online training program for the staff on various matters. That company that we work with has 2 very well-done COVID-19 trainings for staff, and so we'll be asking them to take those trainings. It just talks about the nature of COVID-19, how it spreads. It's not one that panics you when you watch it. It's one that really kind of gives you good information and arms you with good information and helps our staff know what symptoms to look for in each other and in the students. So that training will be taking place. We will not have any assemblies until further notice, no field trips until further notice during the day. Obviously, we'll have some athletic contests and things of that nature. We're going to encourage our families to send hand sanitizer with their students on a daily basis as well, just to help us out. We have an increased inventory of that. There will be hand sanitizer in each classroom. We're installing touchless hand sanitizer stations in various locations in the building, including the cafeterias, as students prepare to go through the lunch line. So those are going to be increased as well, but we want to encourage folks to send those and encourage their students to use hand sanitizer throughout the day. Hand washing will be built into the daily routine. So I talked about the modification of curriculum. This could be part of the modification of curriculum as well, because it takes a long time to get a first grade class through a hand washing episode, let's call it, right? I mean, it's more of an adventure getting them through, because you also want to have some distance between them now. So it's not just something you can do in a matter of 30 seconds. That's a field trip in itself, just hand washing. So that's going to carve into instructional time. I mean, it will, because we're going to take more time hand washing throughout the day. We are adding the bottle filling stations. Many of our water fountains throughout the district, we're able to retrofit a device that goes on top of the water fountain, traditional water fountain, and it turns it into a touchless water filling station. So we're in the process of purchasing those devices and installing them now. In the areas that we're not able to do that, we're going to either strategize with an actual old-fashioned bottle filling station or some other device, but Charles may correct me with that, but I think that pretty much covers what we're happening there. So those are going to happen in every building, so they'll have some bottle filling stations. Now, in the water fountains that are retrofitted, they may not be ice-cold water, because that condenser in that water fountain only chills, so many gallons at a time. But it will be pure water, and it'll be, available to the students throughout the day and staff. We're going to be asking our families, when they register as well, to acknowledge that they understand the symptoms that if their child exhibits, and the fever symptoms that they exhibit, that they understand that they're not to send their students to school under those circumstances. So much like we're in our staff situation now, when you're sending your student to school on a daily basis, you're acknowledging that they do not have and exhibit these symptoms. Certainly not feasible to screen 4,000 people. We wouldn't start until lunch probably in some instances to get people through that as part of the screening. I think I touched on the hydration, so I don't think I need to do that. We did put a stock of bottled water in all of our buildings too, to have on hand for clinics and whatnot. We've had a pallet of water delivered to all of our buildings so that they do have at least a backup supply of water. As far as cafeterias and meal services go, they're going to be served through the cafeteria, but we're expanding the seating. That's going to vary by building, of course. Give you a quick example. At Hattie B. Stokes, you can open the wall and expand your cafeteria seating into the gymnasium, get a really good spacing. That's a very large space. Now you have the full cafeteria and a full gymnasium to be able to space kids. Central gets a little trickier. So, are you going to use media centers, music rooms, gymnasiums? Then you have supervision that you have to work out. But all of our buildings will be expanding their seating to spread students out after they receive their meals. No cash transactions, and of course students will not be self-serving items that will be served from the cafeteria. Any questions about the meal service? I think that was a big question from some of our parents as well. Transportation, at this point we're planning to maintain our regular routes, maximum of 2 per seat unless they're siblings. Could be 3, I suppose, in those situations. We'll stagger the bus entrances up. That just basically means we'll stagger students leaving the buses so we don't have as many students converging on an entrance at one time when they're entering the building. Multiple entrances, both at the entrance and exits. Our drivers have been provided a supply of cleaning supplies, trained on how to use it, and will be expected to clean their buses between routes. Face coverings on the buses are strongly encouraged also, same as the classroom, both for the driver and for the students.
So I'm just thinking of staggering of the buses. They all come at the same time, don't they?
So if we look at the middle school and high school, yeah, they're usually 14, 15 buses waiting there to dismiss, and at a certain time, they all get off the bus. And then the next wave comes in and they all get off the bus. We're looking at, like the middle school, they could go in through 2 or 3 different entrances.
Okay.
So maybe the first round of 14, 7 of them, again, we'll stagger. We'll release one bus, the next bus, the next bus. It'll take a little more time, but it won't take that much more time. I think we can manage it. Same thing with the elementary. They get there, they unload at a certain time, but we can do one bus followed by another, followed by another, followed by another. And I think that will also help with the interior. We're going to ask the students either to report for breakfast or go directly to your classroom.
We'll be moving kids along, right, through passing periods and when they enter the building, not letting them congregate. So this will help us with that piece. It's another thing Dr. Box talked about last week to the superintendents, keep the students moving in the hallway. You don't want to have any prolonged period of time that they're in close proximity with each other. Recess, we'll ask our teachers to require students to wash their hands before and after. The third bullet, don't know what that looks like until it's in action, but we have students in close proximity with students who certainly play foursquare or gaga ball or something of that nature. You can't have the entire playground of spectators outside the gaga ball court, but you could possibly have 4 students in that large space and they could play. Then you could rotate some students, but you can't have some sustained close contact with students. So could they throw a ball back and forth? Perhaps, right? But not having students on top of each other. So we'll know what that looks like in practice. Equipment will be cleaned daily and monitored with the, I mentioned some of the custodial staff that's going to be added to do the daily wiping down of doorknobs, et cetera. So we may be asking them, one of the first things they do each day is to sanitize the playground equipment, maybe help with PE equipment to the degree they can, and the outdoor equipment such as swing sets and jungle gyms and things of that nature. I don't know if we've purchased those devices yet, or if we're still just investigating.
No, we've got two options. One is a disinfectant that we would just spray from a pump tank. We're also now looking at, I don't have the right term, electrostatic clean machines, so that when it sprays, it will cling to the playground. We want to do that before kids get there so they can dry. And we'll
Right.
try and do the same thing with the balls and equipments and frisbees that would be used on the playground sets. Do all those in the morning, daily.
Yeah. So it's actually almost like a electrostatic fogger, if you will, that or mist that you would use on the outdoor equipment to sanitize that. And all of that is free. It's not costing us. I say with tongue in cheek.
But we are, with that though, there is CARES Act money from the
Yeah.
federal government, so we're trying to utilize that for some of the extra custodial support, extra instructional support, and so forth.
Right.
So Kari's been putting that grant together and submitting that, so there are some funds to help, but bottom line, this is still gonna cost us significant dollars to do it right, and that is our plan, is to do it right.
Is that spray that you're gonna use on the playground, could that be used on the inside of the school bus, so the bus driver doesn't have to
Good question.
wipe down the bus and the windows and everything? Could
We're
they
gonna-
spray it on the bus?
Well, the problem is, don't know if it'll dry quick enough at that time, but we are gonna ask them to wipe the seats down as part of their routine.
Right.
So after the morning route, they'll wipe all the seats down. After the evening route, they'll wipe all their seats down. So that'll take them a little additional time. We'll work that out with them. And that'll be our expectation, is to wipe the seats down.
And it is with all the approved cleaners. There's a list that the CDC has provided with.
Sometimes there's the sticky sucker residue or a piece of gum or something that the spray won't remove. So it's gonna be visual, wipe the seats down.
This would be something else too, I mean, this is where a parent can say, I wish my son or daughter not be at recess if they're afraid of the close contact. Just good luck on
Yeah,
telling your
supervising that.
child no recess when the rest of them are out there, but
Right.
it's just, parents have to get kicking us.
Right. And there would be recess is one of those locations that the student could still go out with the class and not take part,
Yeah.
in the activities. One thing that has been consistent in at least the things I've read, and Doc, you can shake your head or nod your head, but go outside. We've heard this a lot, go outside. And so I think it's important to go outside, and we want our PE classes outside on nice days, and we want our classes outside on nice days. I mean, we take your English class out. So I hope to see classes of students outside on these. This would be a perfect day to take your class outside today. So I'll pause here too and mention that I think it's probably a good point, because it's just a piggyback on just this conversation, is that Mr. Tate is meeting with some administrators today and our head of custodial to work on a set of guidelines for classroom teachers, to talk about what's allowable to be on the walls or on bulletin boards, or what can you bring or not bring to your classroom, and all of those expectations today too. So we'll have consistency across the district, and teachers will know from the outset what's allowable and what's not allowable. So that we're working on that as well on the staff side to prepare the classrooms. I don't want to put out any ideas until the document's done and speculate what that may be. May need to alter our passing periods a bit to help decrease congregating students in narrow areas of the buildings or students in any one area of the building at one time. And this is one area that we are going to continue to emphasize with staff and students. It's important for them to wear their face coverings at that time. So this is a tricky one. You know, you've heard a lot of guidance about passing periods. Say, well, just stagger when students are released from class. But I always chuckle. It's like, I don't know if you've ever been a secondary administrator, because if you release a third of the building, they're going to show up at another third of the building, and those students are still sitting in class. So I'm not sure that really helps. Now we have 40 people in the classroom. So it's not as easy as it sounds in theory. But we do have some areas within our buildings, as you know, where there's bottlenecks. And so there may be some traffic flow that we have to alter to keep those bottlenecks from happening. And that may require us to make a passing period longer or shorter, depending on what it might be. So secondary folks are looking at that right now. School visitors right now will be limited to essential visitors. Obviously, if a copy machine breaks or something of that nature, we have to have repair folks in the building to do that. Deliveries, of course, of supplies. Those will be scheduled when at all possible. So we'll know they're coming, and our clerical staff and administrators will know they're going to be there. We will have a higher level of screening for those folks. What that looks like on August 3rd for staff days and August 6th, those are these conversations. That's over a month away. So I don't know what that screening protocol will be for visitors, but we'll know what that is by August 6th, and we'll follow that. Whether it be temperatures, whether it be questionnaires that they have to sign, what that will look like, we'll know more at that time. But we will be requiring face coverings of those vendors and visitors when they're in our buildings. Parent volunteers, this is a toughie because they're essential to a positive school culture and a strong school. But we're not, at the outset of Phase 5, we're not going to have volunteers in the classrooms. We've got to get our feet under us and see how this is going to work. We'll evaluate. I put on here, we'll evaluate at the 9 weeks. We'll evaluate on an ongoing basis. There may be opportunities to bring volunteers in, but not into the classroom. For example, we could, if we need them to help sort materials and things like that for a teacher, there's ways that we might be able to bring volunteers into a controlled environment, but not the classrooms, where they can sort the materials in a room such as this large space to help out the entire school. But we're not going to have adults coming in and out of the building and walking down the hallways and in the classrooms. So I hope folks can understand that. We value our parent volunteers tremendously. This is a hard one for us to swallow because they're so essential, but it's also essential that we do this for a while for our kids and us. The next slide is about 4 or 5 bullet points that basically, full disclosure, don't say much because it's so situational. Positive cases are so situational. We work with the health department on those. Those get reported. Currently at this stage, these are reported to the Indiana, the State Department of Health. They drive the bus on positive cases and utilize the local health department to help them with how to handle it. It's under their direction. That could change too by August 6th. We don't know, but we report it to the state. We'll report it to the county as well. But they're driving the bus there. And you've read a lot about, well, it's an automatic school closure for 2 to 5 days. Not necessarily. A lot of those bullet points are worst case scenario bullet points through that document. But it could trigger an automatic closure of a school for 2 to 5 days. It could be a whole range of responses based on who the positive case is, their potential contacts that they've had. It's just too broad of a topic to be able to sit here today and say, if we have a positive case, this is what's going to happen.
but you're saying at school, so if somebody at Stokes tests positive, that, we don't know yet,
Right.
but that doesn't mean that the rest of the other schools could keep on going.
Could, it may or may not mean that you close the entire school. You've heard this phrase being used, cohort your students as much as possible. That's a new term. Elementaries do that as a matter of practice. It's, it's the same group of students in the classroom, and they tend to move together, they tend to travel together, they go to their music class together. That's a lot different than a high school student that has 6 different classes and maybe in 2 different clubs and play sports, right? So those are different scenarios that you just don't know today, what that would be. So those are situational. This is the one that keeps me up at night more than probably than anything, is the positive case, not just in the school, but in sports and clubs and in groups, because it is so unpredictable, and we'll follow all directives. State Department says you got to we're coming in and we need to contact these 40 people, 50 people, 100 people. That's what we'll do. We'll make it happen, and then we'll take their directive. So that's really the best I can do on that one. We just don't know what it is.
I've
Yes,
got
sir.
a question, and this is really for Dr. Sir. Okay, is the COVID, what are the symptoms different between like just having the flu and having this virus? Because like say a student gets the flu this fall and leaves, is sick, word is going to spread like wildfire that, Robert got sick at school and he's got the flu, but it's the virus. Is there symptoms close or completely different, or? I mean,
Sure,
I
you
don't
can.
care.
Why don't you come on up, Doc? Because then the people at home can hear you, and it'll be on the recording.
Because I could see that being the next thing. The stomach flu will go around,
Right.
and oh hell, everybody's got this,
Right,
so
right.
shut it down. And it's a kid with an upset stomach.
Yeah. Unfortunately, they're the same, or they could be the same.
Okay.
Within the document, there's what's it called, in class, the document
Yeah,
from the
from the
state.
state. Mhm.
In that paper, they try to divide things up a little bit. They talk about a kid who goes home with a fever and does not get tested for whatever reason, and it outlines, they got to be without a fever 72 hours. They got to be out from 10 days from the time of symptoms started, and all the symptoms have to be improved before they can come back. Now they can bypass all that by going to a doctor, a primary care physician, pediatrician, and get a clearance saying, hey, they're okay to go back. But most likely, I'm telling you, as a primary care physician, that kid's going to get tested. He's going to get a nasopharyngeal swab. And then you've got the kids who are testing positive, they're symptomatic. You've got kids who get tested positive, they're asymptomatic. It's my concern with the kids that you're talking about that probably have the flu or maybe just a cold. The primary care docs are going to be overwhelmed, because I don't know of any primary care doc that can examine somebody in the office and say, you're good to go. There's going to be a bunch of testing done on these kids that go home sick, and staff. I mean, it's not just
Right.
students, it's going to be staff too. So
I guess is there going to be a protocol if there is a kid or a staff member that has to leave because they're sick? Will we require them to go get tested then?
well, that's what I'm saying, Michael. It just, and
But
what
it- I
Dr.
mean-
Millman's saying, it's a case-by-case basis.
Right.
You're not going to require them to go get tested, but if they can only come back if they've done those 3 things with the
Right.
fever, the 10 days, or they can go to the doc and say, the doc examines them and say, I think this is just a flu, but we've got a flu test we can do at the same time that we're doing the, the COVID test. So, but it's gonna, I just don't see it. I'm hoping I don't see docs just passing kids off to go back to school.
Right.
I mean,
I just didn't know if, are they still doing testing out the fairgrounds?
no. On Friday afternoon, they decided to leave with no notice. They didn't contact the health department, contact me. They just left. And I think it was because they just weren't busy, and
Right.
all the resources that they were using, it was not very efficient, so they went someplace else. Now, I'm telling you, as we speak right now, the hospital and I are trying to just say it's time to open it up to the community, and we'll just do it. We're just working on how to do it. So, and who gets the test result, and who calls about the test result, and all that. So we're working on that right now. So.
Okay.
I'm hoping that, a lot of us, we don't feel good, we still go to work. We're gonna have to be a little more diligent
Sure.
on those things too. And parents are gonna have to be a little bit diligent.
Right. Great point.
With their kids and careful with that,
Great point.
I think that's gonna help maybe with some of the flu stuff that we normally have, if we are a little more diligent on that during the flu season.
The bug, you're right, I agree with that, absolutely, stay home if you're sick, but, I work with some young nurses who have children, and they were already yelling at me because, we've always said 24 hours out of fever, and you can go back to school. Well, now we're saying 72 hours, and the 10-day thing, and, it's a child care issue there. And if they go to the doc to get a clearance, and they say, let's get you tested. Well, it depends which test, but it could be 2 or 3 days before the test comes back, before they can go to school. So,
Well, like I said, these docs could be overwhelmed, so it might be 2 or 3 days before you even get in.
right, exactly,
So-
exactly. So, but yeah, that's where we're at.
Okay.
Thanks, Doctor.
Thank you.
Well, and along those lines too, I know we talked a while back about attendance and not, encouraging the perfect attendance awards and
Yes.
things like that, but
Yes.
but actual policy. I mean, kids
Yes.
are gonna run out of days.
Right.
And maybe quickly if,
Right.
if they get sick,
Right.
and staff people
Employees.
as well.
Yeah.
So how are we gonna handle
Well,
those
we are
things?
suspending all perfect attendance awards. That's for sure, and that's actually part of our Boone County School District's joint statement that I mentioned earlier. That's in there. We'll be asking families when they call in what symptoms they're exhibiting, to be able to give us some tracking information. But yeah, there's just going to be more grace with that. I mean, there's just going to have to be, because as Mr. Wyrie just pointed out, we're going to be encouraging, this is what needs to happen. They need to be symptom-free, that there has to be some grace around that. There is a school accountability grade currently tied to attendance. It's the federal grade, not the state grade. That federal school grade is based on the Department of Education's application to the federal government, or the Federal Department of Education. So whether there needs to be any update on that from the State Department of Ed's side, I don't know. We may get some more information forthcoming. We're following that as well. There's just gonna have to be more grace all the way around about that. Staff is a tricky one as well. Now, we have talked about the potential of live streaming, not the classroom to the student at home, but possibly the teacher to the classroom. As Doc pointed out, we'll have asymptomatic cases, and they may be home for a while. And it may be in a subject where it's very, very difficult to find a replacement in a subject area that's very specialized, especially at the secondary level. So it's not inconceivable that we could Zoom a teacher in from home who's asymptomatic to be able to support the students. Now, that would come at a cost. This is where we would pull in some of the instructional money from the CARES Act to supervise that classroom, and as the students would rotate through in their normal classes. But these are the things that we have to just continue to think, what if we have an asymptomatic teacher? Could they teach? Maybe. What do we have as a symptomatic teacher? What do we have? What happens if we, again, the positive case piece is the one that for me is it's a tricky minefield. Students, we want them safe and healthy. I've listed what we shared today as a partial list of things we're doing to put things in place for students and staff on a daily basis. Students we want them to get well, we want them to get back to school, but if we have a teacher unavailable for a 10-day period of time, that's major. It's just as far as instruction, daily instruction for all the students. And so, a teacher has 150 students, 160 students on their daily caseload that will not get that teacher's expertise. That's just troubling to think about how that's going to work. So, it's true.
Testing requirements for teachers or for staff,
Testing requirements.
if they go out with symptoms, are they going to be required to take a test?
It'd be kind of the same conversation we had, whether we can make them do it or not. What's our current guidance on that, Mr. Martin?
It gets a little hairy when our current guideline requires a negative test before they can return to work. It gets a little hairy because the state actually requires 2 clear tests, as you have heard, and it may not clear that quickly. Somebody with a loss of taste and smell might have that continuation of symptoms, so while some clear of symptoms and clear of tests might be a problem. So at this point, we haven't determined. We're hoping that there's more clarity around July 20th when we actually put this into a closer time frame.
The CDC's all over the place on that too, but as far as returning, I'm talking, so if they have symptoms, are we gonna require them to get a test? If they call in sick with symptoms, are we gonna require them to have a test?
I don't think we have made a determination on that yet.
Can I say something?
Please do.
Yeah.
Yeah.
I mean, you were right about the testing positive and then retesting, and we had a young paramedic at the hospital that tested positive, was asymptomatic the whole time. We required two negatives 24 hours apart, and this poor kid for 6 weeks continued to test positive, and never had a symptom, so and that's the other thing. We don't even know. I mean, the CDC and whoever don't even know if when they're positive, are they even effective? So I don't think you can require them. It goes back to the guidelines: symptomatic positive, asymptomatic positive. You've got it written out what you're going to do. They're going to have to be out, or they're going to have to go to the doctor and get a note saying they're okay.
Well, I was talking about if they're teaching in the classroom for a week and then all of a sudden they get sick, are we gonna require them to get tested so that we can do trace on who all they've come in contact with?
Yeah, I don't know what.
That's the thing that
Yeah.
I'm looking at as far as,
Yeah.
just a thought process, Doc.
Yeah. Yeah, I don't know what you guys have decided on that. So.
Yeah, I haven't been going down the road of us tracing. It would have been more calling.
Yeah, I mean, you're not
whether
gonna.
it be, again, as you and
Yeah.
I talked the last, it was the state's driving the bus with the positive cases. That I said, what do you need us to do? Actually, we'd be working with you and them, but
Right.
what do you want us to
Yeah.
do? And we'll do whatever you want us to do.
Yeah,
But probably not on somebody who just calls in sick. Probably not. It would be more like, okay, we got a positive case, or we have, something that we're concerned about would maybe.
And that's why I
particular
think the
staff
prudent thing to do would be to go to your physician and see what they say. But
But you're saying we need to have a doctor's note to come back.
Yeah, again, I don't know how it's written and I've not seen that full.
Our policy includes a requirement for doctors to go after a certain point, but the COVID start encouraged employers to not require doctor's notes because of the expectation that they would be too busy to provide an appointment.
Yeah.
So we haven't determined that we would change that policy. At this point, there's not an overwhelming draw. If we become much more overwhelmed, then we'll have to forego the notes just because nobody can get there.
And this is why positive cases are the ones that's giving me the most heartburn.
It's given me the most. Yeah. Yeah, it's going to give all of us the most worries.
When you go straight to the CDC website and they say 72 hours with symptomatic, if you weren't tested to start with, then you could return to work. But if you were tested, you got to
Right.
have the 24, 2 negative tests within
Right.
24
Right.
hours.
Right.
Right.
Right on the same page.
I know.
Right. Right.
Seen that.
Yeah, yeah. Thanks, Doc.
What I call it earlier, the conversational pretzel or the word
Exactly.
salad. I mean, that's what it's,
Exactly.
you're
No, exactly.
taking two different positions in the same paragraph, basically.
Oh.
Yeah.
Our school nurses,
Yes.
obviously, they are not the ones that will dictate, positive or you've got the symptoms or anything like that.
Correct.
But when somebody does call in or somebody does go to, somebody calls in and says, my child's sick, does the front office person take that? Do they
Yes.
direct that? And so
Yeah.
they just keep track of?
Yeah, that's not necessarily something that would get reported to the clinic if a
Right,
student
okay.
called in sick.
Okay. And
Most
then-
of those calls just ignore left on the automated system, they don't talk to someone for.
Yeah.
So that's something we'll probably have to consider is what we ask them to say when they
Right.
report their sickness. Is your child reporting COVID symptoms?
Right. Okay. And then, the school nurse, they know that if the child does come down the house, and, they know all the,
Yep.
precautions or
Right.
the stages and
Yeah.
what to do.
And
next.
that's heartburn item number 2, is the guidance that we have to isolate students exhibiting symptoms consistent with COVID, which Doc just pointed out is pretty synonymous with flu symptoms, right? So exhibiting those symptoms is supposed to be in a separate room from the clinic. So, again, you know our buildings. You know how difficult that's going to be to create a separated area for that and supervise that. We're still trying to work that piece out and where those locations are going to be. But that's part of it. We want our school nurses, they have treatments that they provide to students throughout the day, medications that they dispense to students throughout the day, their daily bumps, bruises, and scrapes that they help us with throughout the day, and that's what we want them to continue to focus on. So there will be some added, items to their plate, of course, and helping with that student who has those symptoms, and then advising that they need to be the ones that are in a different location until their parents are able to come get them. So that will obviously be something that will be added, but we need them to continue to do their work that they're supposed to be doing to support the students. Yeah. Yep. Good question. And then finally, the timeline, which is just giving you a look at the folks that we've spoken to. Brings us up to today. We've met with our administrators in a marathon meeting last week. School superintendents and the health department on the 18th. We met with our Teachers Association. As much of what we discussed today has to do with working conditions, which is a discussable item with your exclusive representative. Met with some parents this week to get their feedback. Met with Pascal this week as well to talk about BASE and our before and after school care. And here we are. So once we move past this meeting this morning, we have everything ready to roll as far as a website and web resources. Much of what we discussed today, there's more detail on, believe it or not. And we put it in a FAQ format. So we've put in the frequently asked questions, and then there's a drop down that they click, and there's an answer to those questions. And as that's going to be a fluid part of our website as well, as we get more questions from the school board, the community, things change, we'll modify that FAQ as things move forward. But we have a message ready to go out to the parents and community following the meeting today. That brings us to that. So I did put this in more of a memo format to you so that there is kind of a document to quote unquote approve from your standpoint. So you're not feeling like you're approving a PowerPoint, you're kind of approving a process and a plan. And so really what I'm bringing to the board today is a recommendation to approve our approach to the phases of learning. And that approach that could be, as I mentioned, dialed up or dialed back, depending on the community spread, knowing that even within those phases, there could be some adjustments needed throughout the process.
Okay.
Long topic, but an important one, so
Absolutely.
thank you for your feedback.
All right, board, I need a motion to the approval of the LCSE 2021 reopening plan.
I'll make the motion.
Second?
Go ahead, Liz.
Okay.
Any questions?
Dr. Millman, I'm sure this has been part of the discussion too, but we know even our own church, even though we're not meeting now, on a national basis, they say there should be no corporate singing because of the water droplets. My
Yeah.
son plays trumpet, there's spit on the floor all the time.
Right.
Like, I know generally we try to clean that stuff up, but in light of this, what extra precautions would be taken, with choirs and
Yep.
instruments?
I've not seen the choir plan yet, but we'll get that to you because I know our middle school and high school folks are working on that. Band has put a pretty comprehensive plan together in kind of a chamber music approach, spreading students out throughout the rehearsal setting. There's also been some interesting studies when it comes to wind instruments, and actually how the air and droplets, because of the nature of the instrument, disperses that, so that at the end of a wind instrument bell, it really does not have much of a spread at all, much more than what I'm doing right now, talking to you, than you would through a trumpet. But we'll have the stepped up cleaning, of course, when it comes to the water valves, I'll call it, on the wind instruments, to step up the cleaning. But the students will be distanced more than normal. Choir is a little, even to me, is even trickier than band, because of just the nature of it. We will have the opportunity to utilize the stage, the auditorium perhaps, to be able to spread students out, so that they're not, stacked in rows. So I think Ms. Chef and others are looking at those type of spaces to be able to spread kids out. And in my experience as a music teacher, that can actually sometimes make you a better ensemble, because you have to listen a little bit more when you're spread out. So they're making those adjustments as we go right now as well. It's a good question.
Thank you.
So when you're communicating, I'm assuming you're gonna communicate all the phases and then
Yes.
focus on where we're.
Yes.
So people see the big picture of where we could
Yes,
slide
and
up
we've tried to
down.
make it very clear where we're wanting to start, because you could look at this phase and go, and your eyes could go directly to phase one and go, we're
Right.
closed. That's not the case. So Mrs. Todderud and I have worked very hard on trying to make that very obvious on the website.
it's a great
and how that
visual
looks.
of-
Yes.
Yes, I
So
think
it's even a little bit better on the website. I think it's even a little more pronounced where we are. So
And a lot of the message that's going out today is very heavily focused on phase 5.
questions? All those in favor of requesting the approval of the LCSE 2021 reopening plan, signify by saying aye.
Aye.
Those opposed? Motion passes. Item number 5, other business, July 7th, online registration opens. Next meeting is July 20th. That is on a Monday. We had to change that from our Tuesday, just this month only. So July 20th is our next regular school board meeting. I'm just gonna say again, like I said last meeting, you go back to our mission statement, it says the power of education, do so in a positive, safe learning environment. We're all in this together. This is not a project that Dr. Millman's just doing. It's his way and nobody else's way. We've got some of our other schools. We've got Dr. Servies and his staff in this, and we've got our employees that are in this too. So again, for those thousands of people who are out there listening to us, please, contact your superintendent, contact your school board, and just ask questions. And we're going to be truthful. You cannot, and we wouldn't anyways. But I mean, in a situation like this, we're going to tell it how it is, and hopefully people will understand that. But there are going to be people that are going to disagree with it. We know that, but that's just the way it is. So I just want to thank you guys, and I want to thank Dr. Millman and his staff for, again, what a great first year to be a superintendent. So, any other questions?
Certainly memorable.
Yeah, oh yeah. Any other questions? All right, this meeting is adjourned. Thank you.